Hello everyone, I hope you're all well. In this video today I want to discuss about safety in aesthetics because it's nowadays we have so many complications, videos and images seen in social media, and I think it's amazing now that people are questioning the treatments before they actually book the treatment, and it's getting better, but there are some important points that we just need to teach everybody so they can find the best and safest practitioner actually or clinic for their treatment. And that's why I want to focus on the aftercare, because somehow the treatment is done by a doctor, surgeon, beautician, whoever, is somehow it's done. But the most important thing, one of the most important thing is the aftercare. Because you can treat a patient, but you need to know exactly how to deal with the complication. So as a patient, if you're, let's say, looking for my field like nose fillers, and you're actually starting to do some research, then you find a couple of reputable clinics and practitioners, and somehow one looks more attractive, and you book. So once you go there, actually you have some homeworks before you go to the appointment, and these are including what product you're gonna use in my treatment and what can go wrong, and if those complications happen, how are you gonna treat them. So you should ask the aftercare and the complications, and if that practitioner is capable of treating the complications and recognizing the complications. Let's say you have the nose fillers, and next day you have a bit of color change in the area. So what it could be? It could be like a simple bruising, it could be venous occlusion, it could be arterial occlusion, it could be hematoma, it could be nothing. So all these different complications needs to be recognized and well understood and treated by the practitioner. So you can't treat a venous occlusion with an antibiotic, for example, or you can't treat the infection with Hyalase. So these complications, they need to be well understood and discussed with the patients. So the non-medical practitioners who offer these treatments, they can be really good at their treatment by experience or by learning it from someone, but how they're gonna diagnose it, how they're gonna fix the problem. And if there is a serious complication like venous occlusion or arterial occlusion, then it requires a serious aftercare treatment protocols like Hyalasing, antibiotics, steroids, hyperbaric oxygen therapy, etc. And they won't be able to help you. And so before booking any treatments, you have to discuss, or after booking your treatment, you have to discuss with your practitioner about the complications and about how they're capable of treating those complications. So if they're not capable of prescribing you steroids, if they're not capable of diagnosing the venous occlusion or arterial occlusion, or if they're not being able to send you to hyperbaric oxygen therapy, then you should question that. Or, for example, the body fillers, the body contouring, or the hip dip fillers or butt fillers, for example. Now, I don't train non-medics personally, but there are doctors who train non-medical practitioners for specific treatment. And, for example, the butt fillers, if they go wrong, you can have skin necrosis as well, or you can have the long-term redness and inflammation under the skin. And if you're calculating about 300-400 mils injected into the area, how are you going to dissolve that? So that means before you're booking those treatments or during the booking, you have to discuss how you're going to deal with the complications with the practitioner, because it may need like a mini liposuction to get rid of the fat in there or to get rid of the fillers in there with an actual liposuction cannula and syringe and the set, etc. So because you can't hyalase, you can't dissolve that amount of fillers, or you may need to prescribe the patient several doses of steroids, or you may need to inject some high dose steroids in the beginning, intramuscular. So all these things, complications, needs to be discussed during the consultation. It's not just to know how you're going to do that, which product is going to be used. You have to discuss the complication and its treatment during the consultation. So that could be one of the most important tips, booking for any surgery, any treatment, even for the most simple treatment like Botox. There is no simple treatment, but comparing to the other advanced treatments, it can be accepted as a simple treatment. But even with the Botox or simple lip fillers, you need to discuss how you're going to deal with the complication. Will you be able to prescribe me steroids? Will you be able to prescribe me antibiotics? Will you be able to diagnose the hematoma or the blood occlusion? So you have to ask these questions actually with your practitioner, and if they are very experienced with all those complications, then you can trust them. And a couple of tips during the treatment is you may actually see them using the alcohol wipes before the injection, sterile gauzes, gloves, and giving you an aftercare actually protocol to follow, like antiseptic creams. If it's like an advanced treatment, some prescribing you some antibiotics, etc. So that's why I wanted to actually bring that topic today up, because it's getting more popular and popular and popular, but actually the awareness is a bit slower. So we as doctors or surgeons or practitioners, we have the actually duty to bring the awareness and teach our patients as well, because at the end of the day it's our business, but we are doctors, we are just trying to help people, and we have to protect their health before or after the treatment. Okay, so if you have any questions about this subject, if you have any comments, if you have any worry, concerns, etc., you can comment, you can ask me directly, privately, and I'm always happy to help, teach, assist, or even learn from someone who is more experienced than me. So our training is always active. We never stop learning. So if you have any comments, questions, please let me know. I will see you whenever you need us. Thank you.